So Gary, thanks for joining us. Talking a little bit backstage about the alphabet soup of acronyms and agencies. Tell us a little bit about BARDA. Some of our viewers may not know what BARDA is, and kind of a day in the life, which must be pretty hectic nowadays.
It is. So Bob, first, thanks for the invitation. I really appreciate being here. Many probably still don't know what the Biomedical Advanced Research and Development Authority is and what we do as part of the federal government response and preparedness for public health. So we were established by legislation under the Pandemic and All Hazards Preparedness Act in 2006. Our mission is to develop medical countermeasures, vaccines, therapeutics, diagnostics, and devices to address chemical, biological, radiological, and nuclear threat, pandemic influenza, and emerging infectious diseases. And we've been very successful. We are the advanced research and development arm for the federal government. So you heard Tony Fauci speak earlier. We are a transition partner for programs that start at the NIH, the earlier research and development, and then we transition those to advanced research and development, typically after phase 1. And to date, we have supported 63 FDA approvals, licensures, or clearances of products that cut across our threat space.
And as far as your job in dealing with other government agencies, how does that work? If you can kind of take us behind the scenes, are there Zoom calls? Because there must be so much more coordination. I'm not saying there wasn't coordination before, but much more now.
So there is. So there's also an overarching body, the Public Health Emergency Medical Countermeasure Enterprise, or the FEMC, which coordinates across the federal government, not only Department of Health and Human Services, but other departments, and brings together the leadership of those different departments and agencies, and it's led by the Assistant Secretary for Preparedness and Response, Ms. Dawn O'Connell, where we discuss the strategies for development of medical countermeasures, response strategies, as well as just any public health concerns.
A lot of issues right now, obviously, that you are in the middle of. Can you just give us a preview, kind of what you're dealing with on a daily basis, the health security landscape as it is now? We've got COVID still, going strong, even though we're all tired of it, but still, monkeypox, kind of where we are right now and where we're going.
Yeah. So, we have a group that's approximately 450 individuals, very dedicated to public health. I could not be prouder to represent them and just how driven they are. So we recently just ended the outbreak of Ebola in the DRC. There's now a confirmed case of Marburg in Ghana and a second probable case. We've been dealing with COVID for the past 2+ years, and now for monkeypox. And for monkeypox, our development of smallpox and our preparedness efforts for smallpox led to the licensure of the Jynneos vaccine, and that was actually the first contract I ever awarded as a federal employee, was the contract to Bavarian Nordic to develop that vaccine. And it is now available to help prevent monkeypox, as well as we supported the development of the 2 antivirals, TPOXX and Tembexa, that are currently being used to treat individuals who are symptomatic. So right now it is monkeypox, COVID, and Marburg, and we continue to work tirelessly to make sure that we're prepared for any potential threat that may come. And the one that scares me the most is the unknown threat. I mean, you heard Tony speak before about a pandemic, a respiratory virus, and that is definitely one of our major concerns. Pandemic influenza is one of the efforts that we support, but it's also the unknown.
What have you learned, lessons learned from COVID?
So first is that the government can really do incredible things when we all work together. So the OWS, the Operation Warp Speed program that was established under the previous administration and has been expanded under this administration, really brought together the best of the federal government. And the reason that it worked is that it was a single person who was making decisions, and that was General Perna. A 4-star general who has since left the federal government, but very thankful for his service. But it brought together the entire federal government on just a unified effort to develop vaccines, therapeutics, and diagnostics as quickly as possible.
And the structure of it too, having one person at the top.
Correct.
That was key.
Correct, because there was no siloing of the different agencies within departments. And we always work together, but this really brought everybody together and really expedited the development of the vaccines and therapeutics.
We talked about monkeypox in D.C. It's now the highest rate per capita across the country. Where are we going with this? Because it seems like it's getting worse.
So hopefully, through public health measures, we will be able to decrease the spread of the disease, and with available vaccines and antivirals to bring it under control. I do think we are going to see the numbers increase for the next several weeks, but we're working very hard and working with the manufacturer of the vaccine to make more vaccine available so that we can address what many people hear is a shortage of the vaccine. There are certain jurisdictions where the demand is outstripping the supply that we have available, but we continue to work with the vaccine manufacturer to make as many doses available as possible.
BARDA has a strategic plan like other government agencies. Where are we going between now and 2026?
So I thought it was, when I became the director of BARDA, our previous strategic plan was issued in 2011. So it was 2011 to 2016. It was one of my primary goals to put together a new BARDA strategic plan. We have learned so much, we've grown so much as an organization. And so the future, the topic for this symposium is innovation, and innovation really is the future for BARDA. We have been very successful at developing medical countermeasures, which most people would consider the standard medical countermeasures, vaccines and therapeutics and diagnostics. But as we move forward, innovation is going to be the key. Innovation is one of our objectives under Goal 1, which is preparedness, to make sure that we have a robust pipeline and portfolio of products that we can move forward. And under innovation, we are supporting different efforts. So in 2016, we established the Combating Antimicrobial Resistance Accelerator, or CARB-X, that was in partnership with our colleagues at NIH to reinvigorate the development of antibiotics. AMR is a huge public health concern, and AMR will also complicate any large event that occurs in the United States or globally. In addition to that, in 2018, we stood up an entire division within BARDA called the Division of Research, Innovation, and Ventures, and they are investing in innovative technologies. We also changed the way that the government partners with companies, and we became more innovative. So we have what is called an easy BAA, and it really is easy for companies to partner with the federal government. It's a 2,000-word abstract. We review it. If we're interested, we have further discussions with the company and can award contracts in as little as 30 days. In addition, we also set up our Blue Knight program, which is our partnership with Johnson & Johnson Innovation, their J-Labs program. And the Blue Knight DC is located right here at Children's National Hospital in Washington, D.C. We've made 23 awards, and these are innovative small companies that we're supporting. They have access to the J-Labs infrastructure, as well as mentorship from BARDA. And then finally, in 2021, we started BARDA Ventures. So BARDA Ventures was an authority that we were provided under the 21st Century Cures Act, where BARDA can partner with a venture capital firm that uses venture capital practices to make investments on behalf of the government. And so Global Health Investment Corporation is our partner under BARDA Ventures. We provide funding and strategic direction to them, but they go out independently and make investments on behalf of the federal government and can take equity positions in those companies.
You mentioned investments in the federal government, and pre-COVID, I think there was maybe a healthy skepticism of investing millions or perhaps even billions now, so we avoid spending trillions. We've seen that with COVID, literally trillions of dollars. Do you think that mentality has changed in the wake of COVID?
I hope, but we appreciate every dollar that we get from Congress, whether it's through annual appropriations or through supplementals. I've always said that preparedness is less expensive and easier than response. If you're in response, you're always chasing the pathogen, versus in preparedness, we're trying to make sure that we have vaccines and diagnostics available, similar to what we did for monkeypox. But we get about $2 billion a year to make those investments across 18 different material threat determinations that are issued by the Department of Homeland Security for different pathogens or agents that we need to address. For COVID, in a partnership with our colleagues at the Department of Defense, we've invested over $68 billion in just over 2 years. And that doesn't even account for the trillions of dollars in economic, setbacks as well as the socioeconomic impacts of COVID-19. So to me, preparedness is less expensive than response.
Last question, this is a big one. What keeps you up at night?
Everything. Sometimes I'm so tired I just fall asleep. But
sometimes it might be hard to fall asleep because you're getting those briefings on what's out there, right?
It's really what keeps me up at night is making sure that I support the team that we have, because they are, again, the most incredibly dedicated group of individuals I know of in the federal government, and there are many great federal employees. But to make sure that we are prepared so that if something does happen, we have the vaccines and therapeutics and diagnostics so that we can appropriately respond.
Oh, absolutely. Well, thanks to you and your staff, and thanks to Gary Disbrow for joining us today and educating us on BARDA. Thanks so much.
Thank you.